Welcome back to PrepSolution's CCRN question of the day. Here is the scenario. 5 days after a mitral valve repair, an individual on an epinephrine infusion is having frequent PVCs. 4 demands arrive at once. The monitor alarms because the radial art line cable is disconnected. The patient reports severe pain. The provider orders a stat 12 lead ECG. The family is at the door and needs isolation instructions. 4 tasks, 1 nurse, 1 UAP. The question is which task crosses the painted line and which one stays in the lane the UAP can take. Your 4 options. Option A, acquire the stat 12 lead ECG for provider interpretation. Option B, reconnect the radial art line cable to the monitor. Option C, document the characteristics and radiation of the pain. Option D, instruct the family on infection control protocols. Pause here. Pick your answer. Ready? 3 answers cross into territory the UAP cannot legally hold. 1 stays cleanly inside their scope. The correct answer is option A, acquire the stat 12 lead ECG. Why the ECG? Picture the corridor as 2 painted lanes. The UAP lane is for tasks that play out the same way every time. Vital signs, standard ECGs, bathing, repositioning. The RN lane is for tasks that require live judgment, pain assessment, family teaching, art line management, vasoactive titration. A 12-lead ECG is a standardized procedure. Lead placement is the same on every chest. The acquisition is technical. The interpretation is the provider's job. That puts the ECG cleanly in the UAP lane. And here's what delegation buys the nurse. 10 minutes. 10 minutes back to assess the new PVCs against a confirmed art line waveform. 10 minutes back to titrate the epinephrine. 10 minutes back to teach the family at the door. Delegation is not a transfer of accountability. It is a transfer of the technical task. The judgment stays. Standardized stays with the UAP. Judgment stays with the RN. The 5 rights of delegation. Right task, within UAP scope of practice in this state. Right circumstance, patient stable enough that the standard procedure carries no surprise. Right person, UAP trained and validated on the specific skill. Right direction, clear, complete, specific instructions. Right supervision. RN remains accountable and available. All 5 must hold. 1 missing right means the task stays with the RN. 4 moves at the bedside. 1. Hand off the ECG. Direct the UAP to acquire the 12 lead now. State the urgency. Do not delegate the interpretation. 2. Take the art line yourself. Reconnect. Verify the waveform. Square the transducer. Treat the new PVCs against a confirmed pressure. 3. Assess the pain. Walk into the room. Characteristics, severity, radiation, then medicate or escalate. 4. Teach the family yourself. Initial isolation instructions are RN scope. Document the teaching before they enter the room. Delegation buys time. It does not transfer accountability. Why the others fail. Option B, reconnect the art line. Invasive line management is RN scope. A loose connection risks hemorrhage, dampened waveform, and false vasoactive titration. The RN has to verify the waveform before any new treatment is layered on top of it. Wrong lane. Option C, document the pain. Documentation follows assessment, and assessment is judgment. The UAP can notify the nurse that the patient is in pain. The UAP cannot evaluate characteristics, severity, and radiation. Handing off the documentation hands off the clinical decision. Wrong lane. Option D, teach the family. Initial education is RN scope. The UAP may reinforce after the RN has taught. First contact teaching belongs to the nurse, especially when the family is about to walk into the room of an immune-compromised post-op patient. Wrong lane. The task crossed the painted line 3 different ways. If you want to pass CCRN the first time, PrepSolution has you covered. 1,200 clinical questions across all body systems, 3 full-length mock exams, 1,000 high-density flashcards, the Clinical Decision Masterclass, an adaptive 12-week study calendar. Thanks for watching. Practice every day, pass with confidence. Please visit prepsolution.com/exam/CCRN for more information.